Hello, and welcome to CommonHealth, an audio series brought to you by the Virginia Community Healthcare Association, where we shine a light on Virginians active in their communities. Their stories help us better understand our Commonwealth and each other. The bulk of our work here at VCHA supports the current workforce at Virginia's community health centers, through training, advocacy, and programming. But a few years ago, we took a step back and noticed some concerning projections in the healthcare workforce. Across the board, in just the next decade, experts are predicting provider shortages in the tens of thousands in fields from primary care and nursing to behavioral health and dentistry. Shortages only exacerbated in rural areas. We quickly realized that we also needed to support the next generation. So the Community Health Scholarship was born. In partnership with our foundation, the Virginia Community Healthcare Foundation, the VCHA Community Health Scholarship provides early career readiness support to future health professionals as they prepare for careers in public health and community healthcare. In 2025, we awarded 6 scholarships to nurse practitioner students and 4 scholarships for behavioral health master's students that are planning on entering the clinical field. We have one of those students here with us today, Gilles, who is pursuing her master's in social work at Virginia Commonwealth University here in Richmond. Welcome to CommonHealth.
Hi, Kate. Thank you so much for having me.
Great. So I'd like to just start, how did you get to VCU in your program here today?
Yeah, absolutely. So I graduated in 2020 from college in the midst of the pandemic. And from there, I actually enrolled in Teach for America, and I had a position in New Mexico. And while ultimately I decided I didn't want to be an educator, I really learned a lot about social justice and culturally responsive pedagogy, which set the scene for my interest in social work. And then I returned to Richmond and I began working at Caritas Women's Shelter part-time and then at home again as a case manager for rapid rehousing. And that really ignited my passion for homeless services. And when I was in the field, I observed how much the clients I worked with benefited from mental health services, but also the need for more accessible services for people who had varying insurance statuses or different kinds of immigration documentation. And this led me to return to VCU to pursue the clinical track.
That's so interesting. You've seen so many different aspects of how behavioral health or social work sort of interact with people at various stages of their lives. So, wow, that's you're informed by a lot of real world perspective there, which is really cool. So why social work in particular, based on all those sort of varying experiences?
My undergraduate studies were in psychology, which I really enjoyed and learned a lot. But what set social work apart for me is the focus on behavior in the context of environments and the impact of systems on well-being with specific attention to the needs of marginalized communities. And I really was drawn to that social justice focus.
Yeah, that makes sense. So you're in your MSW program now. We're recording this in March, so coming to the end of the semester. What year in your program are you in right now?
I'm about to close out my first year, and there's 2 years total.
Hitting that halfway point. Got it. Okay. So you're obviously thinking about your summer plans, but then if you're halfway through a program, you're obviously already thinking, what are you going to do with this? So do you have sort of both short-term and sort of long-term ideas about what you're hoping to do with this degree?
Yes, I would like to continue working with people experiencing homelessness more in a clinical capacity after I graduate. So there's a couple different ways to do that, but right now I intend to try and work at a community service board, like RBHA, Daily Planet. Those are different agencies that serve people with Medicaid or who don't have insurance. In terms of the long term, the honest answer is I'm not sure. And I think it'll be an iterative process as I am in the field and I continue to determine what I'm passionate about, what I want to specialize in. So I'm excited to see where I end up.
That's awesome. So one other, the reason we're here is because of a scholarship. So obviously what we offer, is specific, but there's a lot of scholarship opportunities. And that's mainly because most of us know graduate school is expensive. And there are far fewer funding opportunities than there are at the undergraduate level. So I'd love, especially, you know, you're as someone who's worked in the real world before you enter graduate school, and in fields where graduate degrees are often pretty essential to either even getting your foot in the door or being able to progress. So, what through like those experiences have you learned about the value of scholarship funding in general? Or what sort of barriers are facing people maybe interested in getting a degree like an MSW, but maybe don't have the financial resources to make it happen?
Absolutely. I think this is a really important question and topic. And it's really present for me right now because my internship through my MSW is with VCU's Basic Needs Program. So we provide financial assistance and case management to undergraduate students. And it's a really unique opportunity to be doing social work in higher education. So through my role, I've learned a lot about trends with access to graduate studies and specifically with recent changes and federal reforms in funding. There are these new requirements for Pell Grants, limits on Grad Plus loans. So this is all making it more and more inaccessible to enter the field ultimately. And I think it's so important that we have diverse practitioners and people with lived experience in social work. But because of these barriers, it's becoming harder for people to access. So I think that scholarship funding is really vital in filling that gap amidst some more systemic reform. And I'm ultimately just really appreciative to VCHA for this scholarship.
Great. That's so interesting that you're even, yeah, that you're doing this like work and you're seeing kind of both sides of the coin. Wow. That's really interesting. Well, thank you so much for being here, Eve, and, you know, sharing your perspective. We wish you the best of luck in your studies, and we know you're going to go on to do great things. So really appreciate you being here today.
Thank you so much. I appreciate it as well.
Our next student is April Thomas, who is pursuing her Doctor of Nursing practice degree with a concentration in psychiatric mental health, also at Virginia Commonwealth University. April, welcome to CommonHealth.
Yes, thank you.
So give me a little bit of your background. So what was your journey to your current program at VCU?
So I actually worked at VCU for 8 years, and I initially never thought about applying. When I was thinking about going back to school, I wasn't really sure what I wanted to do, where I wanted to go. And so during COVID, I ended up applying to a different university for a different program. And during it, I wasn't really happy. I wasn't sure if I was going to continue. But I'm one of those people, when I start something, I want to finish. So I was really contemplating, like, should I transfer somewhere else? You know, should I switch to psych? Because I was thinking about it then. And I was like, you know what, I'm going to do my first clinical just to see how it goes. I did that and I did not like it at all. So I took some time off and I started researching where I wanted to go. I knew then that I wanted to do psych. And so all of my research just led me back to VCU since I was already working there. I knew it was a really good program. And I'm just very glad that I switched, because the fact that I had something to compare it to, hands down, the curriculum, the way they did the program, just how they set us up for success was something that I'm very fortunate compared to what I've experienced before and what my other friends that I've had that have been in NP school, they haven't had the same experience.
So I'm also really interested, you know, there's such a wide range in nursing of the different specialties and also levels. So you're in a doctorate program, which is incredible. And
Yes.
so could you speak about why specifically that this track, and then why psychiatric mental health as well?
So for this track, I knew that I wanted to get my doctorate. So initially I was only getting my master's. And I actually have my cousin who's my mentor. She also has her doctorate, and she's like, you need to go back and get your doctorate. And I was like, I don't know. But I'm absolutely glad, because it does prepare you a little bit more than the master's level. Also, it gives you more opportunities. So if you wanted to teach, you can teach. If you want to do more research, you can do more research. So having that extra year where you're doing a project, a doctorate level project, really does prepare you for the profession in a different way than the master's level. Not saying that it doesn't, it just gives you that extra education. As well as for psych, I have always felt like there is a gap in education within my field as a nurse. Anytime I dealt with a patient, as we all know, they have different comorbidities. But when it came to someone's mental health and how that affected their physical health, we really didn't acknowledge it, or we really didn't care for them in a way that was a holistic approach. And so as I was thinking about going back to school, I saw the knowledge gap. I see within my own life and my own family how mental health and getting help has helped me. I was like, I have to do psych. That was just, it just kind of came all together. So I'm very, very excited that I did choose psych because I love it. It's just so amazing. And so, yeah.
That's amazing. Also, I'm curious, what is your project that you're working on?
So my project is is a implementation of a structured preoperative safety huddle within the main operating room. The reason why, I know it's a little different than psych, but the reason why I picked it is I actually used to work on that unit. And when I was going through the list of projects, I was like, oh my God, when I used to work there, they talked about doing this for years. So I was like, I have to hop on this. So that's why I picked that project. And I still were able to work with a lot of people I used to work with, which was really cool.
Wow, that is really, really cool. So, what are you planning to do once you get your degree? Also, where in your degree program are you right now? How much longer do you have?
I actually am done next month. So,
Oh my gosh. Wow.
yeah, yeah. So I am at the finish line finally.
Wow. Oh my gosh. That must feel
Uh-huh.
enormous. A little surreal, I
Yes.
imagine, but
Oh, yes, yes, yes. Because I like throughout the 3 years, I was like, am I ever going to get to this point? But I'm finally here. So I'm not sure exactly what I want to do. I did outpatient and I did inpatient, and I really, really enjoyed inpatient psych. I still work in the hospital. I've been a nurse for about a decade. So transitioning in that role in the hospital will be the easiest for me. But I'm definitely open to different patient populations. Specifically, I just want to have an institution or facility that's going to support me as I transition. That's the most important thing for me. So I'm definitely open to outpatient or inpatient. I'm open to working with different special populations like children or veterans, those type of populations. So I'm definitely open.
wow, that's really cool. I'm sure whatever your journey takes you, you'll make an incredible impact. So, the final question that I'm interested in hearing your perspective on is, especially as someone who didn't go straight to graduate school from undergrad, there's we're seeing, this shortage coming down the pipeline in terms of providers because we're seeing increased barriers at the federal level for folks looking to access loans for various healthcare related programs. So I'd love to hear your thoughts on what are the barriers facing people if they're interested in accessing grad school. What are those challenges? And then what do you see as sort of the downstream impact of that if we're not able to get more folks into these programs and address that provider shortage that we might be seeing?
Yeah, absolutely. I think the main issue is cost. A lot of us who do go back to school at the graduate level, we have families, we're older. And so taking time away from work is very difficult to try to go back to school. We can talk about insurance. And so, you can't just say, all right, I'm just going to not work and go back to school like we did when we were younger. So the biggest issue I feel like is going to be the cost, access to scholarships, access to loans. You can do private student loans, but those are always more risky. The interest rates are a lot higher. I did do private loans when I had to go to nursing school, and those were a doozy. So I would say the number one issue is cost, and there's other trickle down things, time and location and things like that. But the biggest thing is cost. A lot of my coworkers are like, I don't want to go back and spend the money. I don't want to have all this debt, even if they wanted to go back. Now, for the issues that I see in healthcare, we're definitely feeling it. Just from when I first started in 2016 to now, the hospital that I work at now, at night, the hospitals will have the entire hospital, and we have about 200, 300 beds. That's crazy. That this person's responding to all of the pages, or sometimes there's only two of them. That's insane. And even within my profession, my unit, we're supposed to have 6 nurses. That's what we're staffed. And sometimes we're running 4 and 5. And all of that, all of the shortages are always going to affect the patient negatively. And I feel like it's just going to get worse if we really don't start trying to help professionals to get in, get their graduate degrees, and be able to come out and help their patients and help the population.
Wow. Yeah. Thank you for those insights. Yeah, someone who's, seeing it on the ground right now. And thank you for, taking that burden on despite the barriers, despite the challenges, because, we can all see how crucial you are now and the work that you'll be doing in the future.
Yeah.
So yeah, thank you so much for
thank you.
Like the career that you've chosen and for coming on and sharing more with us on CommonHealth. I'd like to thank these scholarship recipients for joining us on CommonHealth to share more about their academic journeys and future goals. Healthcare is about people, patients, and providers alike. Here at VCHA, we are grateful to these students for the futures they are working towards, futures built around caring for and supporting the most vulnerable in our communities. We hope that through continued scholarship funding, like the Community Health Scholarship, we can make futures like these possible for even more students. To contribute to the Community Health Scholarship, please visit vcha.org/Community Health Scholarship.